I think it's to me, it's as a clinical doctor, it's absolutely obvious that all information is important, of course. However, measuring those type of immune response, including antibodies or DNA fragments, without knowing how and at what point of the physiological health or disease spectrum that particular human being is really deceiving, because it won't give us any practical information on how to treat that particular situation. We will know everything about the virus and antibody. However, we won't be able to explain the difference between the human response. So it is important, but absolutely inadequate, and something big is missing here. And something big, I believe, is measurement of physiological health, measurement of cytokine storm, and other human defense related measurements rather than attack related measurements, if you want.
Dr. Artamonov, give us a little background on who you are and what your practice is all about.
Well, I practice mostly interventional pain management, addiction, and functional medicine. I am board certified in 8 areas medicine. Um, we also do a lot of research on modalities that I believe can be important for people, and that includes a lot of integrative medicine modalities as well.
Right, and you have a, shall I say, an Eastern European background, Russian, correct?
Yeah, I was born and grew up in Moscow, went to medical school there, did my training in Germany in psychiatry and neurology, did in China in oriental medicine and acupuncture, and finally end up in this country doing some other medical things. So I do have Eastern medicine and Far East background.
Well, the only reason why I bring that up is because in America, we're strictly biological medicine, a chemical drug interacting with a biological system, whereas in the so-called, what I call the Eastern Bloc, the eastern part of the world, is energy medicine plays a big role in therapy over there, much more so than in America. There are very few people doing energy medicine here. Can you give a quick, brief summary of what energy medicine is and how that applies to, say, Germany, Russia, places you've been?
Yeah, I think it's a very interesting and fundamental topic for medicine in general, and life in general. I think the foundation of life is deal more with physics, electromagnetic field, rather than chemical mediators. And traditionally, for last at least century or so, the medicine start following the path of the chemistry rather than the path of physics. And that's what I think one of the major problem at this point is, that we're not addressing the etiology, the reason for the disease or the reason for what's going on, but rather we're addressing at best how it's done on a chemical level. So we're addressing pathophysiology at best without accessing the fundamental processes, and we don't measure that at all. And that's why we're dealing with so many diseases without understanding of underlying mechanism.
Right. I'm a chemist, okay, and I work with people that aren't that knowledgeable about health, but I explain about energy medicine this way. We all remember maybe the frog experiment, the frog leg experiment back in junior high school, 8th or ninth grade or 7th grade, where they put 2 electrodes across the leg of a frog, and it's a separated leg, it's not part of the body, and it twitches, okay? So it just shows you the profundity of how our body is an electric system. And if we ignore that component of it, then we're missing a large part of it. And I think you made the statement you made, I don't want to be lost, is that we have a physics-based system regulated with chemical mediators, but it's really a physics-based system. And I think that's absolutely true. So, and so we're not getting to the root. So you do we've become pretty fluent now because of the virus, understanding the novel coronavirus. What can you speak to of the coronavirus mechanistically and how that might play into some of your treatment methods?
Well, we know that I'm not going to talk about virology in general. It's a lot of people talking about that. We know what's the COVID-19 is the newest member of the family that we dealt with that for last 15, 20 years, maybe longer. It's a third coronavirus crossing animal species barrier to infect the human population. We know relatively well, what's the different parts of virus are and how the virus attack the people and how we can treat it. I think from that standpoint, and we spoke about it early, we have to look into the pathophysiology, meaning it's not just the virus that we have to deal with, it's actually a reaction of the macroorganism as a human beings, how we treat the virus, how we defend against the virus, how our immune system are. And we all nowadays on every level understand that the virus doesn't affect to the same degree every human beings. And that's what the huge variation is coming from. So it feels like to me, without going into details, that the virus is just a part of the equation. And on a clinical level, we as the doctors have to pay attention to something else. And we can talk about more what something else is. So it's not just the virus.
Right. So I wrote a very small book on immunity, and not being a biologist, I had to learn, and I spent some time at it. And we have an innate immune system, an adaptive immune system, and then I also think there's a tertiary immune system. But most efforts are going towards the adaptive immunity, looking for antibodies and developing a vaccine. So in some respects, that's sort of a narrow-minded approach to solving these problems because we're only looking at one aspect of immunity, the adaptive immune system. But we have more than that. Anyone want to add to that a little bit?
Absolutely. I think, again, I love history of medicine because we learn a lot from history. We're standing on the shoulders of the giants. So
right.
In this case, I'd like to bring to this conversation the example and the 2-century-old conversation, an argument between Louis Pasteur and Anthony Béchamp. So Louis Pasteur finally won for the last 2 centuries. That's why we start paying attention in medicine to the actual bacteria and the bugs causing diseases, rather than to the opposite point of view of Anthony Béchamp when we're talking about terrain or the organism for the where that particular bacteria is replicating, what damage is done to the macroorganism, and why different macroorganisms are reacting in the different ways to the same virus at the same time in the same point of space. And I think that coronavirus, the recent pandemics, is just so obviously brought the same conversation that we have to come back to now between the Louis Pasteur and Anthony Béchamp and revisit the subject of the terrain, of the body, how the body is so different in different people that we have absolutely different clinical picture, outcome, everything. And that's what in medicine we have to start paying attention.
Right. You know, Professor Ioannidis out at Stanford says that, you know, the tragedy of this whole thing is that the early data came in, we misinterpreted how many people were positive, so we guesstimated a death rate of around 3.5%, some people higher. Now we know it's more like the conventional flu. So what that means is a lot of people are resilient, and the CDC flu curve shows very clearly that, you know, it escalates with age. So it's all about innate immunity. And people are dying of this so-called cytokine storm, which really has very little to do with antibodies in some respect. What do you know about that?
Well, it's absolutely logical point because we should measure physiological health as the most important component to determine the aspects of immunity that involved in the controlling viral infection or any infection. Or we'll probably talk at some point that maybe not just infection, but any diseases. We have to measure that continuum of health and physiological health. It's not just one point in time. It's a variety of factors that make the immunity from all different perspectives. I think it's so much more obvious that, again, we have to come back to the terrain, to the human body, and see what type of immunity, how we measure physiological health, how we identify the reaction of the people. And for example, that good example of cytokine storm, why some people develop cytokine storm that kill them, and some people have very mild cytokine response to the normal extent without any cytokine storm. The virus is the same, the strain is the same, the time is the same. However, the response is drastically different. And that's what I think we should talk, how to measure physiological health as a most important component in interaction between the bacteria and the humans.
So let me make it real simple. Right now, everybody's talking about coronavirus testing. PCR to see if there's any little speck of DNA from the virus there. Antibody test to see if we've been infected and had an immune response. And you're saying neither of those are what you'd focus on. You'd focus on a third test, which is really looking at what's going on physiologically in our body, the terrain, as you said earlier. That's been a discussion for 200 years. Yeah, no, that's very interesting, because I think the cytokine storm, it's really a measurement of immune response, and immune response is often called inflammation. And inflammation is really a treasure. It's trying to fight for us, but sometimes it can overreact in the face of something that's about to kill us, and that's why it does that. So, but these same markers exist and can be measured in the physiology of apparently healthy and sick people. So we can kind of tell where people are on the cytokine storm in life, if you will, and how full their vessel is and what their potential is for maybe weathering it versus dying versus not even having any symptoms if they have no elevated inflammatory markers. I think that's what you're getting at here.
Absolutely. As a matter of fact, back in my 20s, I was involved with healthcare policymakers, and the main question we asked ourselves at that time, what exactly is the health? How we measure, everybody intuitively know what the health is. Well, I feel well, I woke up this morning, I have energy, right. I want to do things, I want to smile to my family, go out there and do stuff. I feel good. That's the health. However, we don't know this continuum of health disease. At some point, you start waking up in the morning and feeling not well. You're not diagnosed with any particular problem yet, and probably, realistically speaking, years away from being diagnosed by conventional medicine for some sort of problem. However, those years that you don't feel well, you don't feel optimal in your continuum of health, and that's what we're seeing, the measurement of that, what we're dealing with. We know disease better than health, but without knowing the health and ability to measure, as you said, where you stand at that continuum, how far or how close you are to actual disease, without those measurements, without understanding of that, the disease fight would be always lost. We'll lose the battle. We'll lose the battle.
Right. Now, that's really well said, Dr. Artamonov. And I think the other thing is, I want to segue to the energy medicine for a second. And looking at cytokine storms, we're really looking at innate immunity, not adaptive immunity. Adaptive immunity is what where we produce antibodies, and that's what the vaccines are all about. So in this particular disease, it's actually been studied in animals in the previous coronavirus that the vaccine actually made it worse, made the cytokine storm worse. So really, what we want to do to be effective here is to promote things that augment innate immunity more so than the adaptive immunity. And so, for example, you were a proponent of ozone therapy, and ozone is a reactive oxygen species, and our white blood cells produce a reactive oxygen species, so they're doing the exact same thing. So why don't you tell us a little bit about ozone therapy and what you know about it, and what you think it could do for people that are late stage suffering from this, from any kind of viral or infectious disease for that matter.
Yeah, so the medical ozone therapy has been known for quite some time, probably at least 100+ years history of successfully treating primarily infections and some other diseases. So we know ozone in our society is something that we use nonstop to disinfect the water, the air. So, you know, but however, from the medical standpoint, this country is a little behind the rest of the world, especially countries like Germany and Russia and Brazil, where ozone have been used for a number of years successfully, very safe. The clinical use we know that started during the First War, World War I, when the doctors were using ozone to treat the wounds. It was before antibiotics area, and the ozone was very effective. And then when antibiotics came in 40s and 50s, that slowly pushed back the natural antibacterial and antiviral treatments such as ozone. However, to some point we got lucky with recent waves of viral infection that people start coming back to the idea of the ozone as a universal treatment for any infections. For the ozone, it doesn't matter what kind of antibodies, what kind of particular microorganism you have. It actually successfully kills almost all pathogen known to human beings, including virus.
How does it? How is it applied clinically, and how do you protect against damaging healthy tissue with ozone? It's kind of a loaded question because white blood cells protect healthy tissue, yet they kill pathogens as well. So I imagine it's fairly similar, but I'd love to hear what you...
Yeah, so it's a good question. There is so many mechanisms that ozone works. However, from that standpoint, ozone therapy stimulates the body towards the homeostasis by creating a mild acute oxidative stress and activates certain pathway, to be specific, an RF2 pathway. It's, by the way, the same pathway that activated during the exercise and the fasting in the human body. So it's a universal railroad towards the health and self-balancing of the body. So among some other mechanisms of action, the ozone therapy is able to increase the body's natural antioxidant production, enhance oxygen metabolism, which is a foundation of every cell to have oxygen and energy metabolism at a healthy level, and certainly does modulate the immune system as well. From practical...
Yeah, so there used to be an old-fashioned way to apply ozone, but now there are some more sophisticated ways to get ozone physiologically into the system.
Yeah, so there is a many ways to deliver ozone to the area of interest, so to say. And as an interventional pain specialist, I've been using ozone for the herniated disc of the back, for the joint issues. We use successfully for infectious problems such as Lyme disease. And there's a different ways to do that. The most common in a classic way is so-called major outer hemotherapy, developed back in 50s and 60s in Germany and Russia, even before that. That basically, when we withdraw some blood volume, about 200 cc from the human body, and ozonate it with medical grade ozone and re-inject it into the vein, and that even small amount of ozonated blood, 200 cc, which is about what, 5, maybe 10% of the general volume, start creating the healthy reaction beyond just the ozonated volume. It start creating those adaptive reaction of the organism towards the homeostasis and modulating the immune system. It's almost in a way, it's almost a vaccination as well, if you can use that word in the broader spectrum.
It's a vaccination of the innate immune system rather than the adaptive immune system. But it's
correct.
It still would have to be looked at. The only thing is the adaptive immune system sort of lingers, so you have protection for a longer period of time, whereas this you have to reapply. Have you personally done ozone therapy?
Yeah, I've been doing ozone therapy for the last about 20 years, including all kinds of applications, including infections. We recently have, I think, 2 or 3 patients that we found to be positive with the COVID-19, and without extra measurements of the human response, like we talked a few minutes ago, the treatment turned out to be very successful, at least from the clinical standpoint. None of the patients developed any, cytokine storm, so to say. None of them end up in the hospital. The treatment was relatively safe and quick, and the people end up having a very mild course of the COVID-19 infection.
What do you think about doing ozone therapy on someone who that might test positive for antibodies but doesn't have clinical symptoms? Would that mess immunity up, or would that actually be helpful?
Absolutely not. Ozone is indicated as a universal balancing modality. So we use a lot for general disease prevention and well-being.
Okay.
A lot of patients coming actually for intravenous ozone, maybe once a month, once a couple of months. They have great energy level, great resistance to the immunity. So ozone, like pretty much everything in medicine, is even more effective when it's done without any acute situation. So absolutely, ozone is a great modulator, great balancer, and improve the immune system and modulate the immune system in the right way.
In America, is there any insurance coverage for an ozone treatment?
Not at this point. None of the insurance company recognize ozone treatment, just like almost any integrative or alternative treatments are not recognized by insurances, probably due to the lack of the local studies, which seems to be very expensive if you want to do it in the right way with FDA. And that's the reason why we're developing more science at this point. We're trying to do more studies, apply for grants, and bring the attention of the medical community in this country to this very safe, very effective, very inexpensive treatment.
Well, I learned something significant today. I already knew that, people with cardiovascular disease, respiratory diseases, pre-existing conditions die at much higher rates, 10 times even more than healthy people. And so that should be our primary goal, because the flu vaccine for 2020, the flu vaccine was only like 56% effective against the most common strain. So that's only 56%, whereas being healthy protects you by at least 90% against the novel coronavirus without any vaccine. And then vaccines may not be that effective because we're dealing with the cytokine storm. But what I didn't realize is that ozone really is an immune augmenter, like intermittent fasting or like exercise. And that's new information for me. That's fascinating and valuable information. It's a shame that we can't get this thing more wide. Are there home ozonators, or this is something that has to be done clinically?
Well, there's certainly, I recommend to some patients, especially out-of-state patients, certain setup that can be done at home using ozonated sauna, ozonated water. It's the generator that you have to use for human body is different from the generator that we use to ozonate the air and the water. And the main difference is related to the source of the air, because the ozonator, the home ozonators, they use the air to create the ozone. And as we know, air contains many other things, including nitrogen. And the nitrogen is not a good thing to be used for the medical purposes. So the medical grade ozone generator use the medical grade oxygen without any impurities in the air, and that creates a main difference in safety.
Really good point. Really valuable information. Is your clinic still open under the so-called lockdown?
We're using mostly telemedicine, so we're trying not to bring the patient physically. We're reopening actually first week of May, which is a good news. And certainly we'll use a lot of modalities such as ozone to modulate the immunity, kill the virus, and make people healthy in general.
Right, I love it. Great information, Dr. Artamonov. Thank you so much for your time.
Absolutely, it's been my pleasure. It's a very important subject of cytokine storm, and I hope we will discuss it further, Doc. Thank you so much for having me.
Absolutely.